Bata-bata, paano ka ginawa? Ako si Angel Rivero at kasama ko ngayon si Dr. Jacqueline Pua na nagmumula sa Tuguegarao. Astig! Salamat, Doc, sa pag-guest dito sa
Salamat
atin.
din.
Doc, kapag kayo ay isang OB-GYN, does it mean kaagad na kaya nyo rin maging fertility doctor or specialization talaga siya?
No, kailangan mong mag-undergo ng further training. So, it's 2 more years of training.
I see.
Yes.
Ngayon, when does it start na ang isang mag-asawa needs to start seeking the help of an infertility doctor?
Okay, so for couples who've been together for more than 1 year and they haven't gotten pregnant, then I think it's better for them to seek consult from their doctors.
I see. Ngayon, from your experience, Doc, sino yung mas madalas na nagiging infertility patient? Mga dahil sa edad ba or sari-sari talaga?
There are a lot of causes. But then again, they say na ngayon talagang dumadami yung cases because as we know, women now are more empowered.
Yes.
They get married later because they prioritize their careers.
Tama.
So, and we know that, yun nga, even if wala pang 1 year na together ang couple, if they have some factors that can predispose them to having difficulty in getting pregnant, like, of course, if they are more than 35 years old,
Nako.
we know for a fact na females, when they reach 35, especially when they reach 37 to 38, rapidly nagde-decline ang fertility nila.
Wow.
No, yeah, and in patients with when they know that they have polycystic ovarian syndrome, and in patients with endometriosis, other illnesses that can predispose them to infertility, then we actually advise them na even if wala pang 1 year, let's say 6 months pa lang, and they haven't gotten pregnant, they should seek consult.
Talaga?
Yes, yes.
Kahit half a year?
Yes.
Ngayon, para po sa ating mga taga-probinsya, meron din ba kaya silang mga specialists in infertility? Or is it something na they have to go pa to Manila to really find? Are you exceptional doon sa Tuguegarao na kayo lang?
We have a lot of fertility specialists scattered all in other provinces also. In Tuguegarao, I'm the specialty there. We also have one in Kawayan.
I see.
Oo. Si Dr. Carion also.
Astig. So, marami naman pala.
Marami naman.
Kailangan lang nila maghanap at mag-seek ng help.
Yes.
I see. Ngayon, kapag kunyari nagpatingin na sila, nakakatakot ba dahil, nako, mahal yata to, malaki yung gagastusin ko?
No. So, it really depends. We assess the patients if we can. It's very nice if we catch the patient early because we can actually try to go through the step by step. So usually yung mga first step naman dyan, gamot lang. We try to make them ovulate, for them to have better quality eggs, and then try them naturally kung talagang walang ibang problem.
I see. So kung maswerte sila, sa umpisa pa lang, maaaring mabuntis na sila.
Yes. So it really depends on the problem. And it's usually, the younger the patients are, mas maganda talaga yung pregnancy rate nila.
I see. Ngayon po yung mga kalalakihan, pwede rin silang maging infertile, di ba? So
Yes,
kayo
of
rin din
course.
yung magti-treat sa kanila?
It really depends. So sometimes we do the initial assessment. So we do the semen analysis. And if there are problems and there is a need to refer to a urologist, then we do also refer to a urologist.
I see.
Yes.
Hindi naman po kailangan na super high-tech talaga ang isang hospital to start some sort of fertility treatment.
Hindi naman. Kasi ang fertility treatment naman ranges from the ovulation induction lang and the natural method. If the patient doesn't get pregnant with that, we have IUI. And then, kung talagang for patients with problems na talaga, na hindi na matutulungan ng dalawang yon, that's the time we need to undergo IVF.
I see. Ngayon, yung IVF na yan, talagang parang glaring 3 letters yan eh. Pwede nyo po ba ipaliwanag in simple terms, ano ang IVF?
Okay, so ang IVF or in vitro fertilization is a type of artificial reproductive technology wherein we, instead of the egg and the sperm fertilizing inside the woman's body, what we do is we stimulate the woman to produce eggs, and then we harvest the eggs, and then the husband will also produce the sperm either by masturbation, if kung kaya naman, kung meron namang sperm yung husband, and then the egg and the sperm or fertilization will occur in the laboratory.
Okay.
And then we try to mature the
embryo na
yes,
ba?
into either a day 3 or embryo or into a blastocyst stage, and then yung embryo na yung ito transfer namin sa loob ng uterus ng
Okay. Ngayon, pag-transfer po ninyo ng embryo, isa-isa lang ba ito ginagawa? Or pwedeng, gusto ko 4?
There are possible complications of
Okay.
multi-fetal pregnancy.
I
So
see.
lalo na ngayon, because of the magaling na yung mga laboratories natin eh. They can actually take care of the embryos up to the blastocyst stage.
Wow.
And the blastocyst stage or a day 5 embryo usually has a very good implantation rate.
I see.
So hindi na katulad noon na we try to implant more than one para tumaas yung pregnancy rate natin. Ngayon, maganda na yung
chances.
Yes. So, ngayon, we have what we call the elective single embryo transfer.
Elective?
Yes.
Okay.
So, we usually advise patients na it's better because we have very good chances naman. We just transfer one because the incidence of complications with a singleton pregnancy or yung isang baby lang compared to a multi-fetal pregnancy, mas mataas talaga yung complications. So it's better to have one pregnancy than, kunwari, triplets na magpe-preterm and then magkakaroon ng, we will be able to deliver very preterm na magkaka-problem lang yung baby.
I see. So, hindi pala laging masaya na kambal o triplet o quadruplet. Mahirap pala siya.
Yes, mas maraming complications.
Ngayon, Doc, ano yung success rate of IVF? Kasi, wow, blastocyst na siya, implant na siya, pwede pa rin siyang malaglag, di ba?
Of course. Ang the number one prognostic factor for IVF, when we say prognostic factor, yung makakapagsabi sa atin, yung chances of success is the female age.
Oh!
So, and that's what I always tell my patients. Try to come early. Kasi yan talaga yung
The earlier, the better.
Yes.
Ngayon
yes.
po, kung kunyari, Doc, hindi naging successful, pwede bang mag-IVF ulit?
Of course, yes.
Mahal lang.
Yes. Medyo.
Okay.
But it's not as expensive as before anymore.
I see. So, the earlier, the better, nang ma-solve na nila kaagad yung kung anumang problema nila via medical advice.
Yes.
Thank you very much, Doc.
Thank you. Thank you very much.